So want to disclose that I'm employed by Pearson, and again, Pearson is the continuing education provider for this course. Just a quick note, if you are wanting information on the basic administration and scoring of CELF Preschool-3, you can find that information along with the development of the test on PearsonAssessments.com. There's a previous webinar recording called CELF Preschool-3 Development, Administration, and Scoring. This webinar goes a little step above all of that kind of information. We're focused more on the interpretation of the results that you can obtain for CELF Preschool-3. And also want to say, if you do look up the recordings are not offered for CEUs. So this presentation, which is a live presentation, is available for CEUs. The learning objectives for today are that by the end of this presentation, you will be able to name at least 2 factors to consider when interpreting preschoolers' test results. You'll also be able to explain what it means to assemble a body of evidence to support a diagnostic decision. And you'll be able to describe how recommendations for next steps differ depending on test scores and patterns of performance. And we're going to begin by discussing the factors to consider when interpreting preschoolers' test results. And we'll also discuss how to assemble a body of evidence to make diagnostic decisions, and then use all of the assessment results to inform your recommendations regardless of the diagnostic decision. And then at the end, we'll have a case study that kind of wraps up all the information that we've discussed, and a little bit of time at the end for Q&A. Okay, so the factors to consider before administering CELF Preschool-3. Before administering this test, it's important to ensure that the test is appropriate for the child that you're testing. CELF Preschool-3 was normed on a population of children ages 3 years 0 months to 6 years 11 months. In addition to having information about the child's age and general language level, and what I mean by that is knowing whether the child is verbal, and if they are verbal, how verbal are they? Are they using one-word utterances or complete sentences, for example? What is the child's cultural and linguistic background, and what is their medical history? Examiners should also have experience or training in testing children whose ages, linguistic and cultural backgrounds, and clinical history are similar to those of the children assessed using CELF Preschool-3 in order for the standard scores to be a reliable and valid measure. So these are the factors that are very important to consider before beginning an evaluation, when selecting an evaluation tool, and when interpreting results. Depending on the child's age and or their background, he or she may not have much experience participating in structured tasks like you see here on the CELF Preschool-3. Examples of a population that may not have much experience could include younger children, your baby threes, children without daycare or preschool experiences, children from cultural or linguistic backgrounds that do not have frequent opportunities to interact with unfamiliar adults, or children with significant medical issues, for example. The applicable information should be included when factoring in the results of formal testing. We test children who are suspected of having receptive and expressive difficulties and who may or may not have limited language and literacy experiences. CELF Preschool-3 was normed on a heterogeneous sample of typically developing children because most children, including those from diverse backgrounds, are able to do the tasks that you see on this slide. One of the reasons that we have demonstration and trial items before test items is to ensure that the child understands the test tasks, and if not, the examiner can provide additional prompts and cues at that point to help the child before testing begins. It's only if the child does not understand what to do, even after multiple teaching attempts, that the subtest should not be administered. Birth medical history. Let's see, are there factors that would indicate that a child may be at risk for a language delay or an impairment? Factors like, is there a history of prematurity or chronic ear infections, for example? Hearing and vision are important factors that may impact a child's performance during a standardized test. So you want to know if hearing and vision is within normal limits, and if not, are there accommodations that can be used, and are these accommodations provided in all contexts of the child's day? Has the child had any previous diagnoses? Has the child received any services, whether that be medical-based or intervention-based? CELF Preschool-3 enables you to obtain a detailed comprehensive information about children's language skills when the child uses spoken language to communicate, speaks English as a primary language, and is able to take the test in the standardized fashion. So they're able to focus on the structured preschool-like tasks. They're able to participate in the tasks. And the demonstration and trial items are designed to enable you to familiarize a child with the required tasks and teach the task or provide cues if needed. Demo and trial items are crucial. They're not an optional part of test administration. The purpose of the demonstration and trial items is to ensure that the child understands the test tasks, and if not, provide additional prompts and cues to help the child. And if the child does not understand what to do, the subtest should not be administered. If the child cannot perform the task, do not attempt to establish a basal or a ceiling. Use the information you observed as qualitative information. You can report the amount of cueing or prompting given to the child during the attempt at test administration. CELF Preschool-3 is a tool that's used to support the diagnosis of a language impairment. However, it can be used for much more information and details that can also support recommendations to enable the child to communicate more effectively in contexts such as the home, the classroom, and their community. The CELF Preschool-3 can be used to identify if a child has a language impairment by administering 3 subtests and obtaining a core language score. The subtests for the core language score are the sentence comprehension subtest, word structure subtest, and the expressive vocabulary subtest. If it's determined that the child does have a language impairment and more information is needed, there are other subtests, following directions, recalling sentences, basic concepts, word classes that can be administered to help describe the nature of the impairment. So what are the child's strengths? What are their needs, affected language modalities, content areas, and even conditions that enable the child to communicate most effectively. The assessment can also be used to respond to referral questions regarding early classroom and literacy fundamentals by administering the pre-literacy rating scale and the phonological awareness subtests, and also be used to respond to referral questions regarding language and communication in context. So if there are concerns with social behaviors, pragmatic skills, there is the descriptive pragmatics profile and the pragmatic activities checklist. The core language score is a measure of general language ability that quantifies a child's overall language performance. The core language score is derived by summing the scaled scores from the 3 subtests that best discriminate performances of children with typical language development and from performances of children with impaired language. The receptive language index is a measure of listening and auditory comprehension, and the expressive language index is an overall measure of expressive language skills. The receptive language index and the expressive language index scores meet state or regional requirements to report separate scores for receptive and expressive language, or where appropriate, analogous distinctions such as listening and speaking, or listening comprehension and oral expression. Because sensitivity and specificity data are available for these scores, they can be used to help make decisions about the presence or absence of a language impairment. The language content index is a measure of various aspects of semantic development. The index measures vocabulary and the ability to interpret the meaning of concepts in simple and complex instructions, as well as the ability to comprehend associations and relationships among words. The language structure index is an overall measure of the understanding and use of language form. This index measures the ability to interpret and produce word and sentence structures. Index scores that are new to CELF Preschool-3 include the Early Literacy Index and the Academic Language Readiness Index. Both of these provide information about skills needed to be successful in a school setting. Additionally, CELF Preschool-3 offers 2 subtests that provide information on social language skills, or pragmatics. The Descriptive Pragmatics Profile yields scaled scores, and the Pragmatic Activities Checklist yields an age-based criterion score. So, what kind of test results can you expect to obtain from CELF Preschool-3? Let's see. This is an overview of the available scores that can be obtained using CELF Preschool-3. You have your composite test standard scores and their corresponding percentile ranks. You have subtest scaled scores, percentile ranks, age equivalents, and new to CELF Preschool-3 are the growth scale values. You also have criterion scores that can be obtained for the story grammar portion of the connected speech sample, and criterion scores for the pragmatic activities checklist. And then you have some descriptive ratings that can be obtained for a child's story organization, their ability to recall facts and details, and language structures that are part of the connected speech sample subtest. And this is a view of all of the scores, subtests, and composite scores that are available by age. So because children ages 3 to 6 are at an early stage of language development, it is not appropriate to use a single CELF Preschool-3 subtest alone as a test to make a diagnostic decision. The core language score, the receptive language index, and/or the expressive language index scores can be reported as part of a comprehensive assessment that includes additional measures like parent-teacher interviews, observations, language sampling, etc., to support a diagnostic decision. Although it is always important to have multiple views of a child's performance of certain skills, it's particularly important for young children. Although each subtest in CELF Preschool-3 has robust psychometric characteristics, young children are particularly sensitive to the formats in which they're asked to perform a task. One procedure may not elicit the target behavior, whereas another may. And so it would be easy to overinterpret a good or a poor performance based on one norm reference subtest, even when assessing the child's skills in multiple contexts. So when making a diagnostic decision, Again, use the core language score, receptive language index, and expressive language index composite scores that provide good sensitivity and specificity data in conjunction with other assessment results you obtained during your assessment. Standardized tests are administered and scored using specific procedures, so they're more objective than informal observations. Estimates of reliability and evidence of validity provide a degree of confidence that CELF Preschool-3 can be used to make reliable and valid inferences about a child's language ability. Because the CELF Preschool-3 is a norm-referenced language test, many of the scores obtained can be used to compare a child's language skills to the skills of his or her same-age peers. Using the norm reference scores is not possible if there's any deviation from the standardized testing procedures. However, testing can still yield important clinical information about the child. So let's discuss how to interpret scores and other results. When looking at standard scores and percentile ranks, a score of 82 may not qualify for eligibility of services depending on the specific guidelines of your local education agency or other funding entity. However, it doesn't mean that we can just close the book and be done with this referral case based on this kind of a score. The truth is that children who are referred for testing are struggling, and it's part of the evaluation and interpretation process to determine ways to improve the child's performance at home or at school or in their community. So when we look at children who score between 78 and 90, they are still being outperformed by many of their same-age peers. If you look at a child who scores an 87 and is in the 19th percentile, that translates to 81% of their peers are earning higher scores. And so it's important to look at why and to think about how to improve the child's level of functioning, again, regardless of the diagnostic decision or whether they're going to be on your caseload. There are descriptions to classify the child's performance based on a range of scores. The rating of a child's performance is determined by the deviation of a child's scores from the mean of 100. Scores with one standard deviation, scores within one standard deviation of the mean are considered average. Scores below one standard deviation indicate that the child demonstrates below average to very low language abilities relative to same-age peers, which may or may not significantly impact the child's participation in the home or classroom activities. And this visual illustrates the continuum of ability. So we're talking about language ability in this case. And I want to focus on those children in the marginal or below average, or some would say mildly impaired range. And I'm not going to suggest that children who score within one standard deviation below the mean be in therapy. However, I do want to stress that children are referred for evaluation because there's a concern that they're beginning to fall behind their peers early in their school life, especially considering this young population with CELF Preschool-3, we're testing 3 to 6-year-olds. And we know that if steps are not taken to close the gap could easily widen. So it's important to consider what recommendations can be made. How can the speech-language pathologist help parents and teachers teach children strategies to improve their skills during this critical time of language learning and development? We need to use the information that we find in testing to provide specific guidance to teachers and parents about next steps that can be taken to improve a child's language skills. And those steps don't have to be direct therapy. They could be modeling, facilitating techniques in the classroom for the teacher, doing demonstrations for parents, sending home articles, research, etc. When looking at scores on the CELF Preschool-3, valuable information can be obtained by examining the difference in composite scores. But you can't just tell by looking at the two scores if the scores are clinically meaningful, statistically significant, how prevalent that kind of a score difference is, and whether a domain or a modality should be labeled as a relative strength or a relative weakness. The way you do that on CELF Preschool-3 is to look at the statistics for pairwise comparisons. It's a table that's provided in the manual. And first, you compare the index scores to determine if the difference between them is statistically significant. So here we see the minimum differences between index scores that are required for statistical significance at the 0.05 and 0.10 levels by age. And so you start off by comparing the index scores, and when the difference between the two scores is equal to or larger than the value listed for the significance level, the difference is considered a true difference rather than because of measurement error or random fluctuation. If the two scores are not statistically different, then the child's abilities in these modalities or content areas, if you're comparing language content index with language structure index, can be considered somewhat equally developed. So let's pause here and let's pretend that we are looking at the scores for a child who is between age 3 and 3-5. If we subtract the receptive language index from the expressive language index, and the difference is greater than 9.29 points, so let's say the difference is 12 points, that's a significant difference at the 0.05 level because 12 points is greater than the 9.29. So that's how you determine the significance. Next, if there is a significant difference, then you want to evaluate how rare the score difference is in the general population. So you see that 12 points, positive 12 points, is under the less than or equal to 25% column, okay? And so that means that less than or equal to 25% of children in the normative sample had differences of 12 points. The less often a score difference occurs, the greater the chance that the difference may have an impact on intervention and educational modifications or accommodations. When evaluating standard score differences, the significance of the difference between scores and base rates vary by age on CELF Preschool-3. Index scores are used to examine test domains. Within a domain, subtests differ not only in content, but also in format. So you may note some differences between scaled scores of subtests that make up composite scores. A scaled score of 10 is the average of a given age. Scores of 7 and 13 are one standard deviation below and above the mean, respectively. And about 2/3 of all children with typical language development earn subtest scaled scores between a 7 and a 13, which is the range of average performance. Scaled scores represent performance of language skills in different formats. Differences across subtest scores are related to the child's ability to understand what is required by the test format as much as handle the language content. The purpose of evaluating scaled score differences in CELF Preschool-3 is not so much for diagnosing an impairment. The purpose of evaluating scores at this level is more for how these scores will be interpreted or explained to stakeholders. The age equivalent represents the average age in years and months typical for a given raw score. It does not provide the information needed to determine if a child has a language impairment. Diagnostic professionals report to us that they use age equivalents to explain a child's performance on standardized tests to caregivers and teachers. And they also report that age equivalents are often mandated by agencies at the local, state, and federal level for eligibility and funding purposes. So we continue to provide age equivalents. But what can you do with the age equivalent information? Although it's not a precise measure or even an indicator of age level ability or the presence of a language disorder, age equivalents provide a measure that caregivers and or teachers can relate to as a gross estimate of language ability. The CELF Preschool-3 provides gross scale values, as I mentioned in a previous slide, or GSVs for all subtests except for those that are criterion reference. And GSVs were developed using the performance of children in the normative sample, and they can be used to quantify small improvements in the language skills of children assessed using the CELF Preschool-3. GSVs are a transformation of the raw score, and they're superior to the raw scores for making comparisons for clinical evaluation because raw score totals don't account for differences in item difficulty. So when reevaluating a child with CELF Preschool-3, you can use the reproducible gross scale value tracking form provided in the manual to track scores for multiple administrations. And I want to clarify that this is not a progress monitoring tool. This is a diagnostic test that is often used as a measure to continue to provide evidence that a child presents with a language impairment. So use GSVs to quantify limited growth in the skills of a child with language skills that are below or well below expected for their age. Sometimes when we do a reevaluation, we become apprehensive about presenting the results when a child 1 or 2 or 3 years later is still scoring 2 standard deviations below the mean, for example. This is when you can use GSVs to track a child's skill development on specific subtests, determine if the child has gained additional language skills since a previous administration of the CELF Preschool-3, and measure the efficacy of an intervention protocol that has been implemented for a child. So this is a table in the manual can be used to help interpret scaled score changes and changes in GSVs. And this interpretation table is really useful for interpreting changes in scores from one administration to the next, using the same test, of course, in order to evaluate the efficacy of an intervention plan and whether to continue or make changes as appropriate. So if we look at the second row here, there's an example of scale score does not change, but the GSV increases. So how can that be interpreted? The child's ranking for scale scores, the child's ranking relative to same age children hasn't changed, but the GSV interpretation is that the child is acquiring new language skills. So this chart will help with score interpretation and making decisions regarding treatment plans. The CELF Preschool-3 is an important part of a complete assessment process in which a diagnostic professional collects evidence about a child's communication abilities in multiple contexts. And that evidence is what is used to make diagnostic decisions. So what does it mean to assemble a body of evidence? A body of evidence can be obtained by collecting information from caregivers and or teachers, observing the child in multiple contexts like mealtime, academic instruction time, playtime, etc., obtaining formal test results, so administering a standardized assessment, for example, and informal test results like language sampling, for example. This additional information about the child's use of language in social and academic contexts is what is used to support decisions for educational services and placement or diagnosis. So all of this is about your body of evidence. CELF Preschool-3 is a norm reference tool that enables you to compare results to those of a nationally standardized normative sample, but it's not just a structured standardized test. This test varies in multiple contextual ways to analyze the dynamics of how the child uses his or her language system. So you can obtain ratings from caregivers or teachers. You can obtain a structured language sample from a story retell task that I'll talk more about. You can observe the child and observe their social communication behaviors in the interactive pragmatic activities task. And you can do extension testing, which there are suggestions for in the manual. So I want to talk first about the connected speech sample. This is a new subtest, and it's a structured story retell task. The objective here is to assess elements of macrostructure and microstructure in narrative production. The macrostructure of a narrative refers to the key components and overall organization of the story. A score for the use of story grammar and qualitative descriptions of story organization and recall are provided as part of the connected speech sample results. Alternatively, the microstructure examines the linguistic productivity and complexity at the level of utterances or sentences. And a table is provided in the record form for clinicians to note the use of linguistic structures and compare with the child's performance on structured testing, the word structure subtest specifically. The CELF Preschool-3 connected speech sample scoring that is provided can be used in conjunction with a further analysis based on the professional's clinical judgment. So if language sampling is already part of your assessment protocol and you look at things like mean length of utterance or total number of different words, whatever it is that whatever analysis that you do, you can use the language sample obtained here to continue to do those analysis as well. The first information piece that can be collected using the connected speech sample is the child's level of story organization and ability to recall facts and details. This table is provided in the record form, and the clinician is going to look at the child's retell and decide which description for each category most closely matches the child's performance, and then decide if those results are consistent with other observations or other parent reports or other language sample results, for example. And then what implications are there for therapy activities or for recommendations that can be made to improve the child's overall level of functioning. The use of story grammar in the child's narrative can be assessed and scored to obtain an age-based criterion score based on the child's retell and parts of the story that were included to make the story cohesive and understandable. The examiner can award points and total a raw score. And then using that information, again, decide whether these results are consistent with other results from language samples, caregiver reports, etc. Answer questions like, were there any stories or events that the child talked about during during testing or during collection of a language sample? And if so, did the child provide necessary details about people and actions in the story? Could you follow the child's story easily, or did you have to ask clarifying questions to understand who and what the story was about? The language structures can also be rated as part of the connected speech sample to determine a child's level of mastery with various word structures. So the ratings here are based on mastery data from Brown's stages of language development and data from the performance of children in the CELF Preschool-3 standardization sample. So you can use these results again to decide if they're consistent with performance on structured tests or reported information, etc. I see a question about when was the connected speech sample added to the CELF Preschool-3, or was it always there? This is new. So the CELF Preschool-3 was published in 2020, last summer, and this is a new subtest. It was not offered in CELF Preschool-2, but it is available in CELF Preschool-3. So the connected speech samples subtest is a supplementary subtest. You can use none or all the parts of this subtest to build your body of evidence. Use what you feel is relevant for the child that you're testing. And you can use it in different ways. It's very flexible. So you can use any type of analysis that you typically do using the connected speech sample. As I said, if you want to look at number of different words or MLU, or for example, you can use this language sample that you've obtained here to get that data. You can apply the descriptive ratings for story organization and recalling facts and details to any familiar or unfamiliar story told by the child. The scores for story grammar are based on the no juice retell task. So those scores are very specific to the connected speech sample task. But the language structure ratings, you can also use spontaneous utterances as well as utterances produced during the story retell to get that information on language structure use. And this subtest can be completed after a child has been diagnosed with a language impairment to determine or confirm overall areas of need and to plan appropriate intervention. The connected speech sample subtest can also be used with a child who has not been identified with a language impairment to obtain information on academic language readiness based on the child's familiarity with narrative structures. So if you're testing a child who may not qualify, let's say, as an example, but you want to get some more information to be able to report back to the classroom teacher about next steps and recommendations to improve the child's performance, you may want to administer this subtest. Again, interpret the results by comparing the child's performance with varying tasks, structures and complexity, and what's being reported by caregivers and teachers. So do the results of all of your assessment procedures have implications for future therapy activities or recommendations for the teacher in the classroom? Moving on to the descriptive pragmatics profile and the pre-literacy rating scale, these ratings are may be based on your observations as the examiner, or these subtests may be presented in an interview format with a single caregiver or with multiple caregivers or teachers. The forms appear in the record form and also in a tear-off pad if you would like input from multiple raters. You can obtain information from multiple sources, and you also have the option to use the scores or to use this information qualitatively. For referral questions regarding social communication, the descriptive pragmatics profile and the pragmatic activities checklist are available. This will help you to determine which pragmatically appropriate behaviors did the child exhibit on the descriptive pragmatics profile, and which atypical pragmatic behaviors did the child exhibit during interactive activities on the pragmatic activities checklist. And what are the implications of these results for families and teachers, again, regardless if direct services are recommended. After testing and obtaining the CELF Preschool-3 scores, consider using extension testing to learn more about the factors that may have contributed to a child's errors. Extension testing involves systematically varying the content, directions, and responses required to determine where and when the child's ability to respond correctly begins to break down. His or her errors may result from task or format novelty, task complexity, length or complexity of instructions, linguistic content of subtest items, or the type of response required. Use extension testing to establish conditions under which the child can perform successfully. Extension testing results allow for making judgments about the degree of difference between the conditions under which the child performs the skill proficiently and his or her performance in real life and academic situations. So I'm going to show you an example from the manual of extension testing procedures for the sentence comprehension subtest. The suggested modifications for this subtest are, and again, these are suggestions. You can choose to re-administer the items that are in error, repeating the stimulus to check for facilitation of auditory memory. Or you can choose to decrease the complexity of sentences to reduce memory requirements. The results of extension testing can be useful to inform recommendations for the teacher in terms of accommodating the child by repeating instructions or directions for assignments, or modifying the curriculum by simplifying instructions and breaking large tasks down for better comprehension, or both. Okay, so extension testing, I want to be clear, is done after you have administered the test in the standardized way and obtained scores. This is an extension of that to get more information about what the child needs in order to be successful with these kinds of tasks. A suggested intervention or dynamic assessment activity is to present the pictures that are minimally contrasting and ask the child to identify a picture based on a syntactic feature. So if you want to look at verb tenses or modifiers, for example, this activity can help inform whether a child can learn this skill quickly with direct teaching, or if they need scaffolding and at what level to master this skill. So it kind of helps to determine where you're going to start your goal setting. Let's look at evaluating all assessment results to make diagnostic decisions. The Academic Language Readiness Index score is a composite score that can be obtained for children ages 3 to 6, and it consists of the expressive vocabulary, following directions, and descriptive pragmatics profile subtests. These curriculum-relevant assessment measures are not intended to assign a diagnostic category, but they can be used to describe the language and socialization skills needed to be successful in the classroom setting. The Academic Language Readiness Index score can help inform recommendations for the classroom setting and help multidisciplinary teams design appropriate instruction. The Phonological Awareness and Pre-Literacy Rating Scale subtests were designed to provide an organized observation of the child's early literacy skills required by many local education agencies as a measure of school quality or student growth. The Early Literacy Index score can be obtained for children ages 4 to 6 who are administered the phonological awareness and the pre-literacy rating scale subtests. When interpreting the results of the Early Literacy Index score, evaluate the potential impact of the child's early literacy and/or preschool experiences on test results. It is recognized that phonological awareness and pre-literacy development are critical components of future literacy success. Additional information for your assessment can include a detailed case history, language sampling, observations in multiple contexts with different conversational partners. You don't have to do all of these things here on this slide, but select a variety that enables you to see the child's performance in different contexts and with different partners. How do I reconcile conflicting assessment results across measures? Remember that one form of assessment won't capture the entire picture of a child's language system and use. Their performance may look different across different measures. So sometimes we hear or say things like CELF Preschool-3 says the child has a disorder, but I don't think he does. Or I gave several tests and the test scores don't match up. So how do we make sense of test results that aren't similar? You want to keep in mind that each tool is developed to provide a specific view of the child's communication skills. Tools are not the same level of difficulty, and evaluation tools are not based on comparable research samples. I see a question about what is portfolio assessment. That is referring to a collection of schoolwork. Some children in kindergarten or first grade have, their teachers collect their work and put it into a portfolio so that you can, if you're assessing the child, you can review the child's schoolwork. So we want to use the entire body of evidence you have assembled to make your recommendations. Note differences in the child's performance given different task demands and discuss the implications for a child in a preschool or kinder or first grade classroom. Note the types of communication situations in which the child is able to perform better than others. So what are the facilitating contexts? And note communication situations in which communication and/or language skills need additional support. Okay, so quickly, we're going to look at a case study. I want to leave a few minutes at the end to answer some questions. So this child is age 4-11 and is in a full-day preschool program and has been for almost a year, born full term, hearing and vision is within normal limits. The child likes playing with other children, likes music, song, dance activities. Teacher reports slow progress learning letters, shapes, numbers. Parents report lack of interest with books. The child responds, I don't know, to many questions, but they understand 100% of what she says. From these initial impressions, and this is just a summary, it appears that the concerns are in academic curriculum and language and literacy. So based on information provided by ChildWise teacher and parents, the preschool program speech language pathologist administered a language evaluation to determine if the child manifests a language impairment, and if a language impairment is present, what are the patterns of strengths and needs, and what intervention recommendations can be derived from the child's profile. Okay, so this is the body of evidence we're going to use to help make a diagnostic decision. The clinician is going to, or gathered a case history and background information from the teacher and parents, administered the CELF Preschool-3 standardized assessment, obtained parent information and teacher information through interviews, specifically using the pre-literacy rating scale, and then a language sample was obtained using the connected speech sample subtest. And a breakdown of the scores that you find on the record form, scale score results, composite score results, confidence bands, percentile ranks, etc. And here's a close-up view of the scaled scores. The confidence bands and percentile ranks. Again, we can look at the patterns of performance in terms of which subtests are included in which domains of language to get some initial impressions based on these scores, even an idea about what we would like to probe further in extension testing, possibly. You can see that the two subtests at the end, phonological awareness and pre-literacy rating scale, are lower than average range of performance. So that information looks to be consistent with the concerns that parents and teachers reported. And then we can look at index score differences for information on significant differences in performance. We can determine that receptive language is a relative strength. And language content and language structure scores both fall in the below average range of functioning. But there's not a significant difference between them. And I know there was a question about how do I find the critical value? See, where do I find the critical value when determining the clinical significance between RLI and ELI? Okay. So the critical value in the table is listed as the significant difference. It depends on whether you're using a 0.05 or a 0.10 significance level, but that critical value is found under the significance level. I hope that answers that question. Okay. So the teacher information on pre-literacy skills is reported, and the overall score was less than average performance. The early literacy score is in the low range of ability. Again, we have to factor in the child's history and that she's been receiving direct instruction with this kind of content when some 4-year-olds have not, okay? Because it was reported that she's been in preschool for almost a year. Her story grammar score is 5, and that's in the emerging range. But again, this child has been in the preschool setting. So how is that going to impact the way that we would interpret this score? Considering that she's 4 years, 11 months, she's attended a structured preschool program for almost a year, it's important to note that child Y will need to transition soon from an emerging development stage to a more, It's important for her to transition from an emerging development stage to more adequately develop narrative skills to meet expectations for children who are 5. Her story lacked organization and details in the middle and the end of the story. And the parts of her story were minimally recalled and supporting details were missing throughout. An additional analysis of the language structures used in her story retell in the connected speech sample subtest was performed in comparison with her performance on the word structure subtest. And that analysis confirmed that child Y's use of plural and possessive nouns, as well as the use of irregular and regular past tense verbs, are emerging slower than expected considering her age. So based on child Y's standard scores as well as overall assessment information, she is eligible for language services. She would benefit from direct language instruction provided by an SLP to address her needs in expressive language and pre-literacy skills to enable her to meet the language demands of the classroom. It's recommended to target goals and objectives specifically towards the use of morphology and syntax and to increase phonological awareness as well as letter number recognition. Child Y's assessment results, evidenced by the early literacy index score, also suggest that she may benefit from increased support at home and in the classroom for reading and writing activities. Close progress monitoring by the classroom teacher and the consultation with the SLP is recommended. Providing parents with reading and writing activities through age-appropriate stories is also recommended to support her goals and objectives. And I just wanted to include at the end of this case study another table that you can find in the manual for suggested recommendations for services based on test results. Again, test results may or may not line up perfectly each time, but there are different types of services that you can recommend based on how results are presented and based on, all of the evidence that you've collected with your assessment. Okay. So this is a review of the learning objectives. And we have a couple of minutes. I tried to answer some of the questions during the presentation. We have a couple of minutes, and I'm going to see if we have any more questions. Make sure that you download your handouts so that you can have information on how to obtain your CEs. Okay. I see a question about re-administering items. So I'm assuming that the re-administration is after the standardized administration. You've already obtained scores. The question says, if I re-administer the items in error, I cannot change the punctuation. If you're re-administering items in error because you want to know if there's a context that will facilitate better performance from a child, you can change the items to support what you're looking for. But you cannot change the items during the standardized administration. That has to stay as is in order for your scores to be valid and reliable. After you have done your standardized administration, if you want to do extension testing, you can make changes to find out how the child will perform better, what facilitating contexts are needed for the child to do better. Okay. And this question, there was a question about articulation on the case study. I didn't go into articulation because we're talking about this CELF Preschool-3 language test. There were no concerns with articulation, so there was no testing done in that area. But if testing, is required, you follow the recommendations of your local education agency or funding entity. We were just focusing on the language. What is considered an acceptable interval between administrations of the CELF Preschool-3? There has to be enough time given between the tests to avoid practice effect. So you want to make sure that the child is not, just remembering tests from one administration to another, and that enough time has passed that you can get valid and reliable results. There's more information on reevaluation in the manual, but our time has ended, so I want to say thank you. If I didn't get to your question, we will respond to questions individually. Thank you.